Today I'll be discussing coronavirus. How does coronavirus infect the body? Well, in a nutshell, the coronavirus has something called a S spike or S protein that binds to the ACE2 receptor in lungs. When it does this, it allows coronavirus to enter into the lungs and release its RNA. So it's almost as if the ACE2 receptor is like the doorway for the coronavirus to enter in it. This leads to damage to type 2 pneumocytes, a decrease in surfactant, hypoxemia, shortness of breath, and dyspnea. Now, this is interesting because there have been studies that have claimed that people with diabetes and people who are hypertensive have more ACE2 receptors if they're taking ARBs and ACE inhibitors. So it's almost as if the ACE2 receptor is like an open chair or a throne for the coronavirus to sit on and then enter into the cell. So when people are hypertensive and taking these ACE inhibitors and ARBs, it's believed that there are more ACE2 receptors. In other words, it's almost like having multiple open seats available for the coronavirus to enter into the lungs. It's debatable as to whether or not ACE inhibitors and ARBs should be stopped in such patients in order to possibly reduce their risk of getting coronavirus, but it seems that many researchers have stated that it's best for hypertensive patients to stay on their ACE inhibitors and ARB medications. However, there's conflicting research out there that you can read about. Now let's dive further into coronavirus. Coronavirus is the largest positive RNA virus, part of the family Coronaviridae, and it has 4 different genera. There's alpha, beta, gamma, and delta. Gamma and delta are found in birds, but alpha and beta are found in bats. Now, before I go further, I just want to state that researchers actually knew about coronavirus back in the 1960s. However, the coronavirus pandemic that we're facing today in 2020 is a novel coronavirus. It is a new type of coronavirus referred to as SARS or SARS-CoV-2. The reservoir for coronavirus was bats, and it still is for this novel coronavirus. However, the intermediate host previously was civet cats that were eaten in China and then passed to human beings. The reservoir for COVID-19 is still bats. However, it's passed to pangolins and then to humans, supposedly. So the intermediate host has changed over here. Coronavirus, or at least the one that researchers did know about previously, was the second most common cause of the common cold. What still holds true about the coronavirus that we are facing in 2020 is that it's a positive single-stranded RNA virus that's linear and has helical nucleocapsid and envelope. It's 80 to 160 nanometers in diameter, hence making it the largest RNA virus that has positive sense RNA, and that it's spread by mostly airborne droplets, more so than fomites and the fecal-oral route. The coronavirus can last outside for approximately 9 days, and it can be destroyed with heat and detergents. The coronavirus has virions that appear as a crown on EM. It has spike proteins on the surface that allows for it to attach to cells and is considered to be antigenic. The name coronavirus comes from the fact that it looks like it's wearing a crown. Corona in Latin means crown. So you can consider this coronavirus to be a royal virus that has reigned over the world. It's quite the fancy virus because it has a coat, and its fancy coat is its envelope, and it's single, so it wants to make friends. Unfortunately, it's quite the deadly friend to have. So what makes the coronavirus such a difficult virus to find a vaccine for or a cure for? One of the reasons why is because it has such a high mutation rate and recombination occurs as well. And this is because it has an RNA polymerase that is quite error prone. And because it's error prone, it's able to make many different strains of the coronavirus. So it's difficult to establish immunity to all different types of strains. The coronavirus infects the GI tract as well as the upper and lower respiratory tract epithelial cells. It's able to survive the acid inside of the GI tract, and thus it causes gastroenteritis, so patients may experience vomiting and diarrhea. It also infects the upper and lower respiratory tract epithelial cells, hence the pulmonary findings. There are 3 core symptoms that patients with coronavirus go through that includes fever, cough, and shortness of breath, usually 2 to 14 days after exposure. There are also lower respiratory tract symptoms like pneumonia, septic shock may occur, acute respiratory distress syndrome as well. If you take a look at a chest x-ray or CT scan of a patient with coronavirus, it looks almost as if they have pneumonia. You'll also see consolidation and ground glass opacities, which gets worse when the patient is further along their disease course. Diagnosis of coronavirus is usually done by real-time PCR. To check the upper respiratory tract, a nasopharyngeal or oropharyngeal swab can be taken, and to check the lower respiratory tract, one can do a bronchoalveolar lavage or also tracheal lavage. But there's more to coronavirus than just that. Let's discuss some of the surface proteins of coronavirus, or as I like to call it, the jewels on the crown of the coronavirus. So the coronavirus, like I said before, is quite the fancy virus. It has a crown, it has a coat, which is its envelope, and this crown has many different types of jewels. Let's talk about them. One of the jewels is H1, or hemagglutinin protein, which allows for the virus to bind and enter. There's also E2, which is a peptidoglycan glycoprotein, or the spike protein, and this allows the coronavirus to, again, bind and enter the host cell and allow for it to fuse. There's the N protein, which is basically the ribonucleoprotein, the E1 protein, which is the matrix glycoprotein. This one is a transmembrane protein. The L protein, I'm sorry this got cut off over here, but this is the L for large protein, which has RNA polymerase activity. And like I stated earlier, the name of the 2020 coronavirus that's causing the pandemic is SARS-CoV-2. How can coronavirus be prevented? Well, there are various different methods, and I'm sure most of you already know about them by now. Prevention of coronavirus involves using the correct PPE, and this can include gloves, wearing masks. This PPE is also different for healthcare personnel. For example, if you work at a hospital, you might have to wear a waterproof gown, non-sterile gloves, N95 face mask, goggles, and or face shield. Whether or not you have coronavirus, you should be washing your hands thoroughly with soap and water for at least 20 seconds. Or an alternative to this could be using an alcohol-based hand sanitizer that has at least 60% alcohol. So make sure you avoid touching your eyes, nose, and mouth, and your face in general, because coronavirus can survive on surfaces outside of the body. So you never know when you touch a hard surface, that surface might have coronavirus on it, and then you end up touching mucous membranes through which the coronavirus can spread through. So it's very important to be careful to not touch your face and maintain good hand hygiene and good hygiene overall. Another way to prevent getting coronavirus is by social distancing. It's important to stay at least 6 feet away from other individuals, especially during this pandemic. Just because a person seems like they don't have any symptoms of coronavirus and they seem to be perfectly healthy, they could actually be infected with coronavirus. Just coming in contact with such a person might put you at risk for getting coronavirus, so it's important to maintain social distancing. How is coronavirus treated? Well, unfortunately, the only quote-unquote treatment there is supportive care. So this usually depends on the patient. Some patients could have a severe case of coronavirus and have multi-organ damage, in which case the doctors need to find ways to keep those organs alive. It really varies from patient to patient. So now I'm going to discuss in more detail the mechanism by which coronavirus causes damage to the human body. After binding to the ACE2 receptor in the lungs, it damages the type 2 pneumocytes, which then leads to a decrease in surfactant because, as you may know already, the type 2 pneumocytes of the lungs produce surfactant in order to decrease surface tension. If there's a decrease in surfactant, then there will be an increase in surface tension, which leads to alveolar collapse and decrease in gas exchange, leading to hypoxemia. The type 2 pneumocytes that are damaged release inflammatory mediators, and that leads to macrophages being activated and releasing cytokines like IL-1, 6, and TNF-alpha. IL-1 and 6 are pyrogens, and they induce fever. How are they able to do this? Well, the IL-1 and 6 go to the blood, to the hypothalamus of the brain. This is how I draw the brain. Sorry, I know it looks a little weird. And that resets the body temperature and causes fever. These cytokines released by the macrophages recruit neutrophils that release proteases and reactive oxygen species. When this happens, It damages type 1 pneumocytes as well as type 2 pneumocytes. And that again leads to decrease in surfactant and ultimately leads to hypoxemia. When there's hypoxemia and damage to the lungs, there's productive cough, which basically means cough with sputum, shortness of breath, dyspnea, and increase in respiratory rate because the patient has to put more work and effort in order to open up those alveoli and allow for gas exchange to occur and to breathe, essentially. The chemoreceptors sense the low PO2 and stimulate the sympathetic nervous system to increase the heart rate, which leads to tachycardia. So you'll find that some patients with coronavirus may have tachycardia. There's also systemic inflammation because of the inflammatory mediators going into the blood. This leads to septic shock, which increases capillary permeability, decreases blood volume, causes vasodilation to the arterioles, decreases the total peripheral resistance because if you're vasodilating, you're decreasing the resistance. That decreases the blood pressure and causes hypotension. And if there's decreased perfusion to the organs because of hypotension, that leads to multisystem organ failure. So, for example, if there's less blood going to the liver, that increases the liver's AST and ALT. If there's less blood perfusing the kidney, that leads to increased BUN and creatinine. So what labs would you order for a patient you suspect might have COVID-19? Well, you would order a CBC, which is pretty routine. You would check to see if there's an increase in BUN and creatinine. Renal function tests. You would check the liver function test to see if there's increased AST and ALT, and you would also check the CRP, ESR, LDH, and D-dimer. CRP and ESR are basically non-specific markers of inflammation, and if those are increased, that would tell you that there's an increase in inflammation. And you could also check the procalcitonin. What procalcitonin tells you is if there's a bacterial infection, so it's quite possible that despite the patient having coronavirus, that there could be a superimposed bacterial infection. You could also check a chest x-ray of the lungs or CT of the lungs to see if there's any ground glass opacities and or consolidation. So that's coronavirus in a nutshell. These are quite trying times, and I know it can be difficult for many people to stay indoors and limit their physical interaction with others, but we must keep in mind that it is incredibly important that we practice some unity and understanding in order to decrease the incidence of coronavirus